Hello, my name is Marie O'Connor, a student in the Doctorate of Nursing program at Sacred Heart University. The educational content in this online video module was adapted with permission from the Agency for Healthcare Research and Quality's Share Approach training curriculum. The Agency for Healthcare Research and Quality, or AHRQ for short, is an agency within the United States Department of Health and Human Services. I have participated in AHRQ's Share Approach Train the Trainer curriculum and am certified as a Share Approach trainer. So, have you ever heard of shared decision making? If not, that's okay. It's a new healthcare initiative that's sweeping across the country. Before we go into the educational component, I want you to keep in mind that you can pause the recordings at any time. There will be 4 modules delivered throughout this entire curriculum. At this point, let's start with the first module called Shared Decision Making. At the conclusion of this video lecture, you should be able to define the shared decision making process, explain the key steps associated with SDM, and describe the members needed for the shared decision making process. The SDM process begins with the healthcare provider and patient working together to make the healthcare decision. The optimal decision incorporates the best current evidence for available options, the provider's knowledge and clinical expertise, and the patient's values, preferences, and goals. Okay, so how do I do this? Who's involved? Where do I even start? First, let's talk about how to incorporate SDM into a clinical care patient-provider encounter. AHRQ has developed a training program called the Share Approach. Prior to developing this training program, 2 renowned authors named McCall and Clayman conducted a systematic review of the literature to identify the most frequently referenced elements of shared decision-making. Based on their findings, they described 9 essential elements of SDM that should be included in any shared decision-making model. As a result, AHRQ contracted a company called Afaya that has developed this curriculum, including all 9 essential elements called the Share Approach. This slide provides an overview of the Share Approach. Share is a mnemonic to help the learner remember the 5 steps. So in the next 5 slides, I will describe each step in detail. Step 1. S. Seek your patient's participation. Communicate that a choice of treatment exists and invite your patients to participate in the decision-making process. Many patients are unaware that they can and should participate in their healthcare decision-making. In addition, many patients are not aware of the uncertainty in medicine and that outcomes of different treatments are variable. Let's go over some useful tips to help you invite your patients to participate. First, you should summarize the health problem clearly and communicate that there may be more than one treatment choice. Ask your patient to participate with the healthcare team in the decision-making process. Help the patients understand that he or she is being invited to ask questions and discuss options with you. Assess the role your patients want to play in the decision-making process. Provide ongoing cues during the interaction about why their input is important. For example, you can say, "I would like your input at this time." Ask your patient if she or he would like family members or caregivers to participate. Step 2. H. Help your patient explore and compare treatment options. This step involves discussing the benefits and risks of a treatment option, so the provider's knowledge about risk and benefits of the treatment and the use of evidence-based decision aids are very important to this step. We will be discussing more about decision aids and other resources in other recordings to help you do this step. Let's go over some tips to help your patients explore and compare treatment options. Assess what your patient already knows about the treatment options. Some patients gather their own information before seeing their provider. After assessing, then explore those different options together. List the treatment options and describe them in plain English. Clearly communicate risks and benefits for each option. Explain the limitations of what is known and unknown about the options and what would happen with no treatment. Offer evidence-based decision aid tools whenever possible. Finally, summarize by listing the options again. Step 3, A. Assess your patient's values and preferences. Some healthcare providers may not be aware of the outcomes that matter most to their patients. In fact, studies have shown that healthcare providers truly aren't tuned into the things that really matter to patients. And other studies have shown that patient treatment decisions often change after patients become fully informed about their available options and the associated risks. The best decision for your patient is the one that takes into consideration his or her preferences and values. Talk with your patient about what matters most to them and what outcomes are important. Some tips to help you accomplish Step 3 are encouraging your patient to talk about what is important to him or her regarding the options. Use open-ended questions. Avoid questions with yes or no answers. Listen actively to your patients. Show empathy and interest in the effect that a problem is having on their patients' lives. Finally, come to an agreement on what your patient prefers and is important to them. Step 4, R. Reach a decision with your patient. Making a decision may take time. Check to see if your patient needs more time to consider the options and discuss them with others. After assessing the treatment options, including the benefits and risks, and guiding your patient to express what matters most to him or her in determining the best option, decide together on the best choice. Your patients may choose to delegate the decision to someone else or decide not to make a decision. In that case, active surveillance may be the option. Schedule follow-up appointments to carry out the preferred treatment or active surveillance. Some tips to help your patient come to a decision after jointly talking about the pros and cons of the decisions are asking your patient if he or she is ready to make a decision or if they have any additional questions. Asking if he or she would like additional information tools such as patient decision aids to help them make that decision. If more time is needed, schedule another follow-up session. Confirm the decision by asking your patient to describe the option he or she has chosen. Have other staff members schedule appointments to carry out the preferred option. Step 5, E. Evaluate your patient's decision. Once a decision has been made, it's important to follow up with your patient on how he or she is doing. For patients facing life-threatening conditions, some of the decisions will be irreversible, so careful follow-up is needed during the treatment phase. For decisions related to management of chronic diseases, the decision should be revisited periodically. Some tips to aid in evaluating your patient's decisions are making plans to review the decision in the future. Decisions may be reviewed and changed if they're not working well. Monitor the extent to which the treatment decision is implemented. Help by managing barriers to implementing a decision. Provide access to self-management support programs and other resources. Finally, reconsider other options if the preferred option is not working. So, who's involved in the shared decision-making process in the clinical setting? The entire medical team should be familiar with and involved with the process. Since the entire medical team is involved in the process, let's look at the collaborative roles they'll be playing. First and foremost, it's the patient. The patient is the active participant and is at the center of the shared decision-making process. The primary healthcare provider, such as the physician, physician assistant, or nurse practitioner, should communicate that the healthcare choice exists and invites the patient to be involved in that decision. The provider presents the options, describes the risks and benefits of each, and explores the patient's values and preferences. A decision coach can be assumed by nurses, social workers, or health educators. A decision coach can help assess factors influencing a patient's decisional conflicts, provide support to address decisional needs, monitor progress in decision-making, and screen for factors influencing implementation. Support staff and/or managers can organize the clinical practice to incorporate SDM. This person manages the library of decision aids and technologies and manages the clinical processes. Family members and caregivers can be an important influence on decision making. They lend support in clarifying values and preferences, and families can be legal proxies for children, elderly, or the seriously ill patients. Finally, other team members, including medical treatment specialists, may need to weigh in on the decision. Let's go over some key takeaways from this session. SDM is a two-way street. It occurs when a healthcare provider and a patient works together to make a healthcare decision that's best for the patient. The SHARE approach is a 5-step process for SDM that includes exploring and comparing the benefits, harms, and risks of each healthcare option through meaningful dialogue about what matters most to the patient. Finally, all members of the healthcare teams need to be involved with this process in order to make it successful. This concludes the overview of the main points of SDM using the SHARE approach. All pictures, videos, and educational materials used in this recording were derived from the Agency for Healthcare Research and Quality SHARE approach Train the Trainer curriculum with permission from AHRQ. The original curriculum materials are available at www.ahrq.gov/sharedecisionmaking.